Your Houston chiropractor, Dr. Gregory Johnson, and today we have Milton here, who's with us from Saudi Arabia, and we have discovered that Milton has weaknesses in his right deltoid, his right biceps, triceps, and brachioradialis, and did have really severe weakness in his opponent's muscle as well. And what I've determined from his testing is that he has a cervical brachial plexus problem that is causing a weakness in the deltoid and his entire right upper extremity as compared to the left side. Let's just show him here, Milton. See, this is rock solid compared to this one being real mushy. That feel tons weaker, Milton? Mm-hmm. Okay, and same thing happens with the biceps and triceps. So now, this is a very unusual adjustment that you're seeing me do right now. I'm doing a Gonstead seated cervical adjustment of C5-6 right there. Okay, now just let this hang right in my hands here. Slide down your chair a little bit more. There you go. And, well, that wasn't it. Okay, let it go in my hand, get tension. There we go. That was better. And I've got one more lower. You got to hook the spinous and then get way in on the lamina, and it's more of a P to A adjustment than it is a rotational adjustment. Then we're going to put him on this spinal decompression here and decompress his entire spine on the y-axis. Let's go ahead and put your legs down there. There we go. Now we checked his reflexes here previous to this video, and his reflexes were all good in the biceps, triceps, and brachioradialis. Slide it that way just a little bit for me, Milton, up top of the table a little bit more. There you go. Okay. There we go, good. Okay. Milton works for a large company based out of Houston, does a lot of work in Saudi. And we have a lot of people like that work for large companies here in Houston or overseas. Had one come in from Norway just last week. Thor. Okay, put that back there. Get my wet towel, which is just a plain bath towel that I get wet so that I get a better grip and it doesn't slip when I put it on the patient's occiput and cervical spine. Alright, Milton, take a deep breath through your nose, keep your teeth together, and just let it all out and relax. Let it all go. There we go, good. How far down do you feel that pull, Milton? All the way? Yep. Good. Okay, there we go. He's in there playing tight. See, he's still got good knee reflexes going, so he's still kicking. Now, just to supplement that, just drop this in my hand. I'm doing a Palmer diversified rotary brake on him, which really worked better even than the Gonstead adjustment on him in this particular case. And you know, different patients require different adjustments. That's why we do things so differently here at Advanced Chiropractic Relief, because we treat individuals for what they need individually, not for just through an assembly line. Okay, let's come over here on your tummy sideways. And let's have you go on your tummy there. Okay. And I do check his entire spine still, so his legs are even, they stay even, that's good. He got just a little tightness right here in his sacroiliac joint and lumbosacral region, so I'm adjusting his sacrum bilaterally and in the middle. L5, straight superior to inferior in the Z-axis. All the way to L3, L2, and L1. You can see the angles changing. Let me just do a normal thoracic spine general manipulatory adjustment, which you probably heard those and those. There we go. And when I'm talking, it's harder to hear them. Now, because he's got a lot of cervical thoracic muscle hypertonicity in the levator scapula and the trapezius muscles and rhomboids up here, I am just digging my elbow in, right in on those trigger points. On this left side first. And then we'll get over here on the problem side on his right side. You're right-handed too, aren't you, Milton?
Yes, I am.
Yeah, so it should be stronger on the right side, but in his case, because of the neuropathophysiology going on as a result of the vertebral subluxation complex, he's actually weaker on his strong side. There we go. And what the doctors first tell you it was, Milton? Carpal tunnel syndrome. Well, I checked his opponent's muscle, and it was not carpal tunnel. I found that right off the bat. You don't have to get an EMG done to find out if you have carpal tunnel syndrome. Sometimes it can be called double crush, and that's where you're pinching the nerves out of the cervical brachial plexus and in the arm and wrist someplace in the median nerve. Okay, excellent. So let's sit you up and face towards your knee, and I'll adjust your shoulders. So we still want to make sure that we're getting the entire pathway. So now he's got some crepitus or some grinding in his right shoulder. There we go. So just adjusted the right shoulder in the glenohumeral joint. And you got a little crepitus and rotation, circumduction there as well. And the left one went really well there too. You're relaxing a lot better now, aren't you, Milton? Now he knows I'm not going to tear his head off. Of course, Milton's a big boy. He might tear my head off. There we go. See, we get all the fingers and digits, and then whenever anybody has any kind of weakness in their upper extremity, including in their hands, I do a straight pull on the hand, but I pinch together the radius and ulna, which opens up the carpal tunnel and the median nerve. There, his elbows were out on both sides. Those all moved nicely. And both wrists have been moving pretty good. They didn't need to move that much today. Same thing over here. Just grip it like a handshake. Squeeze the radius and ulna together. And then pull straight out on the hand. Excellent. Okay, now let's come back over here and check the posture in the mirror. Okay. Now, let's have you flex your head forward and backwards again. Alright, now, neutral. As you can see in the lateral posture, he's still got a little bit of forward head posture. That's because he's been sleeping that way for years and years. You can open your eyes, Milton, see how you're gazing down. So, to get that better, we're going to mirror image him. So we're going to pull both shoulders up, pull back, flare your hands forward. And then I'm going to bring his head straight back. Extend it on the y-axis, and we're going to translate him opposite of his, which was, he was a positive SX cervical. Now I'm putting him in a negative SX cervical translation and adjusting his atlas, which will send a bombardment of neurological impulses into the cerebellum, changing the posture, balance, coordination, and kinesthetic movement of the cerebellar function. Okay, you can relax now again. Flex your head forward and backwards again. Much better extension. Yep, that's a little better. Posture's up better. How's that feel compared to the first one? Simpler, smoother?
Yep.
Good. Okay. So, mind telling our YouTube crowd, let's see. You've been here what now? Total of 4 times?
Yes.
Okay. How's it done for you compared to the medical treatment you've had for this?
This is absolutely great. I can actually have movement in my arm where I couldn't even lift it past this point. Right. When I first got here.
Good. You feel like you're getting a little strength back in there? In fact, let's test that again and show them. Let's sit right here and just see. Go ahead and face Renee though, so that way they can see you. There we go. I got one of these pins. People about fall over when they step on those pins. Okay, now same. Here's the left shoulder. That's a good one. That's good strength. Now here's the right one, and that's much improved over the first one. Let's do your biceps now. Hold. That's a ton stronger, triceps, and that's a ton stronger. How would that feel to you? How much improvement would you say that was?
That's a lot.
About 100% over what it was, huh? Excellent. This is your Houston chiropractor, Dr. Gregory Johnson. Thanks for watching and subscribing and sharing our videos. We'll see you next time.